so I'm going to perform neurological examination now, if you agree.
Yeah.
So let's begin with cranial nerves, okay?
Okay.
So please follow the hammer with your eyes only, don't move your head.
Oh, sorry.
No problem. Only eyes, don't move your head. Okay, you go 30 degrees to the sides, yeah? And 10-20 degrees up and down. This is how you assess the range of motion. This is how you assess the convergence. You see that the eyeballs converge, and during that the pupil is constricting. Okay, so then we assess pupillary light response. When you do OSCE examination, you don't have to comment on everything. You can just show what you're doing.
Examination.
Yeah. Okay, so I am telling you what I'm doing. I'm assessing direct pupillary light response. So I light the left pupil and I see that it constricts towards this light. If I'm putting the light to the left pupil and looking here, I'm assessing the consensual light response. But it's impossible in your dark eyes
Yes.
to see the pupil. But you can see the direct.
I have dark eyes, that's why.
Yeah. Okay, so
Черные глаза.
Impaired. Okay, fine. So we assess third, fourth, sixth. Now let's go to fifth. Yeah. I'm going to
Pin.
yeah.
Penetrate.
No,
Penetrate.
with no penetration.
Okay.
So when you do it, don't need to touch your group mate. Yeah,
Okay.
just imitate it. So
No problem.
here
You can touch now.
okay, can you hear it?
Yeah.
Left and right
Mhm.
symmetrically. Is it similar on both sides?
Yes,
Is it
ma'am.
sharp or dull?
It's like sharp.
Sharp. Great. Here and here.
Yeah.
Sharp or dull?
Sharp.
Same on both sides.
Yes.
Here and here.
Yes.
The same. So 3 branches, left and right.
Yes,
okay?
ma'am.
You may also assess Zelder zones, which are innervated by different levels of the trigeminal nerve. Yeah? So you move from the ear towards the nose, and you ask whether the patient is feeling that.
Yeah.
Everywhere all the same. Yeah,
Yes, yes.
everywhere you feel sharp, and here you feel sharp everywhere.
Yes, ma'am.
Great. So now I'm going to palpate the masseter muscle and ask the patient to chew. Please chew. Great. And occipital muscles. Yeah, chew. Okay, great. So next facial nerve. Raise your eyebrows, please. We are assessing the folds, yeah, the wrinkles on the forehead. Okay. Now make an angry face. Frown. Frown. Yeah. Like
Yes, like a Russian cat.
amazing. Okay, now close your eyes tightly. Okay, great. Now smile with your teeth. Okay, great. The cat again.
Cat
Wild
again,
cat.
right? Wild Russian cat.
Devil.
Devil.
Okay, now pout. Puff your cheeks. Puff out your cheeks. Okay, great. So 7th nerve, yeah, intact. Next 8th we don't assess. 9 and 10. Open your mouth. And I'm assessing not the cavity. I'm interested in the soft palate and uvula.
Uvula.
Like that. Open your mouth and say ah. Relax your tongue. Okay. Some people just can't show their throat. Yes, and Sar can't. Okay. Could you try
Say
again?
You want to say my
Yeah, throat.
Sansar say ah.
Yeah, great. So you see that soft palate is symmetrical, no drooping, and no uvula deviation.
Deviation, yes.
Okay. We then ask the patient to take a sip of water, make several sips. Yeah, and we estimate how the patient can swallow.
Yes, and
After that,
Yes.
after that, we estimate the patient's voice. So there
Again
is no
say,
nasalalia.
nasal, yes.
Just we just
Nasality.
continue talking.
Yeah.
H and M.
Yeah. Then we take the paper tube.
Yes.
You just say it, no need to imitate it yet. And again, putting the light to the throat, you touch the back wall of the throat to evoke gag reflex.
Gag
Yeah, on the
reflex.
left side, on the right side.
Yeah.
You just say it, okay?
Okay, ma'am.
Then we ask the patient to protrude their tongue. protruded. Great. No deviation, no folding, no fasciculations. Everything's fine. Okay. Cranial nerves finished. Next, sensory system. So we address the patient and assess tactile sensation. No need to. You just say it, yeah?
Like,
It's fine.
Okay.
Leave it. So tactile sensation first. You apply several strikes on the left, on the right side. Is it symmetrical?
yes.
The same, yeah, on both sides. And what can you feel?
This same.
It's some touch, yeah?
Symmetrical.
Like brush is touching me.
Yeah, great. And here and here and here and here on the symmetrical areas, yeah.
Yes.
Everywhere.
Yeah. Okay.
Then where is the needle?
ये बीच में हाथ क्यों नहीं लगा रही?
Okay. Then you do pain.
Yes.
Yeah, here and here.
Here.
Can you feel it?
No.
Yes.
Yes, I am.
Yes, of
Is
course.
it sharp or dull?
Sharp. Sharp.
Sharp. Okay, here and here, here and here, all the same.
Yeah.
All the same, all the same, all the same. Okay, if you suspect some lesions, of course you do it in more detail.
Detail.
Yes. Like the patient can't feel the pain, right? If there is a lesion.
Okay, for example, I reached your palm, yeah, and you said you can't feel it here.
Okay.
Then I will assess whether you can feel it here and here and here and here. You come and compare, yeah. If you can feel it here but can't here, I would suspect ulnar nerve lesion, for example, yeah, or radicular lesion if it spreads, yeah, to this area. Okay. If your whole left side is not feeling, then it's
Please.
hyperstasia. Hemiplegia is about muscle strength.
Okay. Yeah. But please.
Next is proprioception, muscular. What's that?
Yes, proprioception.
Okay, close your eyes. This is your first, second, third, fourth, and fifth finger. I'm going to touch one of them, and you tell me which finger I'm touching. Which one is that?
Middle.
Great. So this is your zero position, and I'm going to flex or extend your distal phalanx. You tell me what I'm doing.
Okay. Flexing.
Great. Now, what finger is that?
Is that ring finger?
Okay. So this is your 0 point. What I'm doing?
Nothing. Flex. Like
Mm-hmm.
extension.
It
Little
was
bit.
extension.
When
Yeah.
Russian women, when Russian women get married, they take the finger into left or right? Right.
Right.
Right, this one.
Yeah. Okay. So in your PDF, they say you should assess the proximal phalanx and wrist and this. But if the patient can feel the distal phalanx movement, then probably yeah. Yes. Right.
Yes, ma'am.
Fine. So next. Sensory finished.
System finished.
Now
Cranial now finished.
motor.
Water.
Relax. Do nothing. Don't help me. I'm assessing muscle tone. So do 5 to 6 flexion extension movements on the
Yes,
right
ma'am.
side in the wrist
On the left side.
and the left side, and compare.
It's the same or not?
Then move on to the next joint. Relax it.
मोटर मूवमेंट ऐसे चेक हो जाएगा जैसे बेटा पेशेंट को धक्का दे दे.
Note that.
Video.
Note where I'm holding
Yes,
the hand. I'm not holding here so that the wrist would do this. Yeah, it's uncomfortable.
Uncomfortable, yes.
So take it here. Okay, great.
Yes, ma'am.
So then we should ask the patient to lie down in the supine position. So could you please remove your shoes?
Yes.
अरे वो मोटर फंक्शन तो ऐसे चेक धक्का दे पेशेंट के खींचे खड़ा हो रहा है मतलब ठीक है. मैं एक्चुअली जस्ट डिस्कसिंग सम इम्पोर्टेंट. हाँ वीडियो एकदम सही बन रहा है.
And relax. Do nothing and don't help me. I'm now assessing muscle tone in your
लोअर लेग.
Okay.
Again, 5 to 6.
यार तीसरे टांग की भी तो मसल चेक होनी चाहिए ना.
नहीं यार वो नहीं.
Relax.
तीसरे टांग की मसल चेक तो होनी चाहिए. यार मेरे को लग रहा है मेरे में जो कमजोरी है यार.
Same in the feet.
Yes, ma'am. That's what we saw.
Now, muscle strength. I'm asking you to raise your hands. And I'm going to suppress this movement.
Yeah, and we have to.
Here in the, not in the forearm, And the arm.
Arm.
Is it arm?
Yes, arm.
Arm. Okay, fine. Now flex your elbows and pull and resist my.
Resist. Force. Resist my force.
Yes,
Cervical.
resist my force.
Cervical plexus.
Not only plexus, but
Yeah.
also.
Ulnar
Yeah,
nerve,
brachial
radial
plexus.
nerve, yeah, brachial
Mhm.
plexus.
Now I'm going to push you, and you
Define.
Different. You have to resist the motion.
resist.
Now you
Yeah,
resist.
great. Now squeeze my fingers
ज़्यादा तेज से नहीं कर दियो
as tightly as possible.
नहीं मैम ने मेरे को बोला था मेरे में
It's not painful when you
मैंने भी
give the
tight किया,
patient two fingers. The patient is not
Okay.
going to break them. Yeah, great. Okay, now raise your straight right leg. Great.
Straight.
And
Straight.
put here.
बढ़िया घुटना मुड़ दिया
Good way.
Well, now flex them in your knees.
Knee.
Like-
Both.
Okay.
Okay. And now try to extend it. Extend
खोल.
your left
आगे की
leg
तरफ आगे की तरफ
in the knee joint.
Okay.
Only knee joint. So push my left hand.
Like this.
उठा.
Like you are.
Okay. Okay.
Kick-
Like,
kick-
okay.
किक कर
Okay.
रहा है जैसे किक कर रहा
Yeah.
है
Great. And here. Great. And now do the
Opposite.
opposite. Yeah.
पीछे की
Flex
तरफ.
in your knee. Flex. And here flex.
Kick
Great.
back
Now extend your knees. And you can assess the
Yes,
muscle
okay.
strength here.
Yeah.
But they propose to do it while asking the patient to walk
Walk.
on
To
their
walk,
feet
yes,
and
Gait.
uh, toes and
Toes on,
heels.
gait
To
assessment
check the
And
gate.
now we do coordination test while you are still in the spine position. Close your eyes. Raise your straight right leg.
What?
Raise your leg.
Hmm.
Touch your left knee with your right heel.
Right heel.
Yeah, yeah. And extend the no. Yeah, extend
Extend.
the foot.
Yeah. 2.5.
Foot.
And draw a line from your heel to the toe. Or from your knee to the toe.
This is.
वो तेरा
अरे दारू पिए होगा ये टेस्ट होता है ना?
Great.
नहीं cerebellum
Then do the same
Cerebellum.
here
Same.
with eyes closed. Yeah. First you raise the
Okay.
leg,
Yeah.
then you touch, and then you draw a line.
Toe to toe.
Amazing. Great. Now please stand up.
and what if someone is obese
They have difficulties with every motion.
no and they won't be able to do that so how do you assess
Another like
Why?
because of
that must not see. So they're fat.
I haven't seen
That
that
much
big
of
patients that they can't do this. But if they do assess do the other tests,
okay
no problem. So now put your feet close together. Don't touch the couch. Raise your arms. Close your eyes and stand. Try to hold balance. And you protect your patient here
Fall down.
From falling.
Yeah. Now
Just fall.
please touch your nose with the index finger of the arm and the opposite. And once again on your right hand. Yep,
now it's
great.
correct
Uh-huh. Put them down. Open your eyes. Walk on your toes, please.
Like this.
Yep. Like this.
Calf
So
to
we are
walk.
assessing muscle strength here. Yeah. And now walk on your heels.
Heels.
Yep.
And then the ball.
Yeah. Yeah. That's it.
कर ले भाई. That's it.
That's all.